My name is Jeff Koor, and I'm the Executive Director of the Mesa County Health Department. The overall mission of the Health Department is to provide services from the perspective of both a client-based prevention approach and also from a public-based prevention approach. So in some cases we do provide those direct services such as our Nurse Family Partnership Program, our WIC program, our clinic, whereas those are opportunities for folks to improve their own personal health but also the health of their families, which leads to an overall more healthy community. From the population prevention approach, we have programs that are related to community health education. We have our Informatics program, which is data collection and report compilation or distribution. We do a lot with communication, and those programs are really focused on trying to educate the community as a whole, kind of a risk-reducing approach. So, certainly with things that come along during seasons, with say West Nile virus or hantavirus or flu season, it's good for us to be able to be out in front of those issues with various communications to members throughout the community. Not only are we doing that through the various media outlets, but we're also going in and talking to specific groups about how they can work to prevent illness amongst members of their cohorts as well. So within the health department, sometimes we provide the direct service, or sometimes we work with other agencies who provide the direct service. Over the past couple years, we've gotten away from trying to go after lots of grants that will allow us to be the direct provider of certain programs. And we'll go after those grants, but we'll do it on behalf of other agencies in the community because we really want to support other agencies to do the work. If need be, we will fill those gaps, but ultimately what we want is for other agencies, we want to empower our partners throughout the community. And truly that is the role of government. And so what that's done is it's taken us away from being a competitor in the community for various grants, especially competing with agencies of like missions, to supporting those other agencies. It's really worked out well. I think it's widely appreciated in the community, and it's also allowed folks to look at us as a resource. So I think we've made some big inroads in the community as far as our collaboration goes. The health department, we're made up of between 16 and 22 various different programs. Each of those programs, they supplement each other. When I first came here, it felt like we were lots of different programs working under the same roof, but maybe not working together in some instances. So now I think we do work more together, and that's what we certainly strive for. For example, let's say we've got our consumer protection program, which is restaurant inspections. Think about that from the perspective of disease prevention. So consumer protection works with disease surveillance, which also works with emergency preparedness, because emergency preparedness is all about responding to emergencies related to certain outbreaks of diseases or other things that affect a population's health. So as the best that we can consider ourselves and each of our individual departments supplementing each other, that's really what we want to work toward at the Mesa County Health Department.
I'm Veronica Dane Harvey, and I'm the Communications Manager here at the Health Department. The Communications Department serves sort of a varied role, both promoting Health Department programs internally and externally. So I do all of the media relations and respond to interview requests to speak about our various programs, and also if there's a public health concern, I'm instrumental in getting the message out about that. And then internally, I help promote wellness challenges. I make posters and signs directing people where to go within our agency, and just kind of do an overall look at our agency branding. It's a variety of county dollars versus various grants that come up and can fund part of what I do when it's applicable. I fall under the Population Health Division. Communications is important because it allows my department or me to just focus on getting the word out about what the people who are actually here in our agency, the work that they're doing. So communications allows them to do what they know how to do and uncover sort of public health things that the public needs to know, and then I get to focus on helping get that message out there. So that's the external importance of what I do, and then internally I just sort of help make our agency function and try to help programs communicate with each other and also help them figure out how they can get the message out about what they do.
Monique Mall, I'm the program manager with the Consumer Protection Program. The main part of our program includes retail food establishments inspections. So that's restaurants, grocery stores, any place that serves food to the public. We inspect those and we provide food safety education to all the food handlers in Mesa County. We also have a child care inspection program. We inspect schools, kindergarten through 12th grade schools. We have a set of regulations that we use to inspect those facilities, and we inspect non-community groundwater systems. So they're kind of small wells for public places, like maybe a child care or a school or a camp. And we also have the body art program. So all of these programs we inspect, we provide education, and we investigate complaints. We have one admin and 3 field inspectors, although right now we have one open position. About 70% of our funding comes through licensing fees, and the other 30% is from county dollars. Our program falls under population health. Our program is all about prevention, and it's preventing a public health issue such as a foodborne illness outbreak.
My name is Renee Landry. I'm the program manager for the Mesa County Health Department Disease Surveillance and Response Program. Our regional epidemiologists help support 16 local public health agencies on the western slope. We also have a zoonosis program which deals with animal and vector illnesses that affect humans and animals. We have a TB program that covers latent TB control and also responds to active TB. We have a nuisance program that covers complaints about trash and any other public health issues that may affect the general public. Our air quality program does testing and monitoring of the air quality in our community, also tracks pollen, and deals with complaints concerning air quality or odors. Our program has 4 employees. Funding for our programs come from multiple sources, locally through Mesa County government, also state funding, and some federal funding. Disease Surveillance and Response Program is under the Population Health Division. The goal of our programs is to keep people healthy in Mesa County. That's through control of preventable diseases and conditions, situations that may cause illness, and also to monitor the air quality so that we can assure people have a good, healthy environment to live in.
My name is Aislinn Tolman Hill at the Mesa County Health Department. I'm the program manager for the Regional Emergency Preparedness and Response Program. Our program provides services to 10 counties in western Colorado related to public health, emergency preparedness and response for planning, training, and exercise. We really help these counties with their preparedness, response, and mitigation activities related to public health. There are 3 people on the regional EPR team. The EPR team also works very closely with the regional EPI team. Our funding source comes from the CDC, down to CDPHE, and then to Mesa County at the local level. The EPR program falls under the Population Health Division at Mesa County Health Department. Regional EPR is very important because it helps local health departments and the population as a whole be prepared to better respond to, if it's a natural disaster, a public health emergency, all types of different disasters and emergencies. It helps them prepare, respond, and then recover from those emergencies.
My name is Allison Sanchez, and I am the Health Promotions and Informatics Program Manager. Our program works with the community to identify social and environmental factors that impact the health of our community, and we then work with our community partners to develop interventions that would address those factors and overall improve the health of our community and our public. There are 4 of us, myself. There are 2 health promotion specialists and a research specialist who works with our informatics data. Our funding source as our team comes from the county, but we also work with several different grants that we implement, especially in the area of tobacco, and we use those grants to support our funding as well. We fall under the Population Health Division. The work that our team does is important because we directly work with the community to address factors that are impacting everyone on a daily basis. We are able to work with our community partners to use assessments and surveys and very real data to take a look at what's affecting our community and how can we intervene and how can we develop programs that will address those issues. We also work with our community partners to work under a common umbrella and a common messaging so that people within the community who are in search of services or needs can find them conveniently and in one place rather than having several siloed services within one particular need. We also are able to work tightly with different groups so that we understand the needs across our entire population, and we are able to make a difference across the population using those team members.
I'm Jillian Miller, I'm RN. I'm Program Manager with Nurse Family Partnership.
And I'm Felice Daniels. I'm also an RN, and I am a Program Manager with the McV side of Nurse Family Partnership.
Nurse Family Partnership is a program designed to help first-time pregnant moms and their child succeed as a family. We're kind of divided up. So on my side, I have 8 RNs, 1 administrative assistant, and 1 full-time interpreter.
And on my side, I have 4 RNs, a half-time admin assistant, and then we also use the interpreter. We fall under client services.
Well, again, we're divided. My portion of it is under the tobacco settlement dollars. Those monies comes through in a grant, and every year we reapply for that grant. And then we also, our nurses bill for Medicaid for services for each woman who is Medicaid qualified.
And on my side, MCV, which stands for Maternal Infant Early Childhood Home Visitation Program, is federally funded, and it's also grant funded.
My name is Dr. April Goggins. I'm the Chief Medical Officer for Mesa County and the Medical Director for Clinical Services. We offer contraceptive counseling and dispensing, and in addition we offer female annual exams, PAP tests for cervical cancer, sexually transmitted infection counseling and testing. We deal with infections and problem visits down here, and in addition we do routine vaccinations for school, work, and aging individuals, and travel vaccinations for those going out of the country. About 10 at this time employees on our staff. We're part of client services. Our mission is important down here in clinical services because regular health exams and regular health testing can help find problems before they start. Finding these problems early can lead to better odds for treatment and cure. By getting the right healthcare services, our patients are taking steps that increase their chances for living a longer and healthier life. In addition, access to contraceptive services promotes health and well-being by allowing men and women to plan for pregnancy. Vaccines help by exposing your immune system to dead or weakened versions of the same pathogens that cause the disease, thus allowing you to develop immunity without becoming sick.
My name is Michelle Colon. I am Program Manager for the Regional Lab of the Mesa County Health Department. We offer public and private potable water testing for Mesa County and for 16 other counties that surround us. We also offer strep testing for the clinic services, and we offer health department support with communicable diseases, shipping, hazardous waste, things like that, disposal. Right now I have one full-time person that I'm sharing with the clinic, and I also have a backup emergency person if we need to, so one-ish person. The lab supports itself. All the money that we take in goes back into the lab. The lab falls under the Population Health Division currently. What we do is important because we are an available source for drinking water potability testing. We do it, we are a certified lab. We do it for public customers to provide water for their clients. We also are a source for private customers that do not have any regulations to back them up, so we offer that service to them to check on the potability of their family's drinking water to prevent illness and things like that.
Felice Daniels, and I am half-time program manager with SafeCare. SafeCare is an evidence-based program that offers services to people who qualify given characteristics that meet certain characteristics. So we see families in their home as long as they have a child that is in age range 0 to 5 years old. They have to qualify, I mentioned, with characteristics. So if they are meet qualifications either by income guidelines, or they need help with parenting, or they need help with safety issues, they need help finding resources in the community, we are able to go out and see them as long as they do not have an open child welfare case. I currently have 5 employees on staff, and I am a half-time program manager with SafeCare. We right now are grant funded, and we're finishing up our first cohort. So the first go-round, there were 4 sites, and we were part of the pilot program and getting ready for another round. SafeCare really brings a unique model to our community, and it is evidence-based, so it's proven that it does help families to reduce abuse and neglect in the home. And with our program right now, collaborating with Department of Human Services, it's really brought a lot of families into our caseload into the health department that we could help to teach safety, health, and parenting skills to.
Okay. My name is Tony Rubakawa. I'm the registrar for Mesa County, and my official title is Program Manager for Vital Records. We provide certified copies of both birth and death certificates to the public, to other agencies such as Department of Human Services, law enforcement, DA for criminal investigations, and we assist with corrections on both birth and death certificates. We issue disposition permits that are required before a body can be buried, cremated, donated, or transported to another area. There are 3 employees on our staff: myself, Lisa Hudson, and Janet Sessom. Our funding source comes from Mesa County. We're included in the Mesa County budget. We do, however, generate a lot of our own revenue from the services that we provide. We charge for the issuance of birth and death certificates. Vital Records falls under compliance and administration. The services we provide are important to the residents and citizens of Mesa County as well as throughout the state. We're able to issue birth certificates for all of the state of Colorado. Those certificates are necessary for business transactions, passports, school, sports, all those kinds of activities, as well as the death certificates families need when someone has passed away in order to get insurance benefits and take care of the family business.
My name is Pat Stiles, and I'm a registered dietitian and the manager of the WIC program at the Mesa County Health Department. You know, I manage the WIC program, which is the Women, Infants, and Children's Nutrition Program. And our program provides services to pregnant women, women who just had a baby, infants and children up to the age of 5. We basically have 4 main categories of the services we provide. First would be nutrition education. Secondly, we provide breastfeeding supplies such as pumps, as well as breastfeeding education. Third, we provide referrals to other community agencies. In fact, in many agencies, WIC would be the entry program for people coming into social services, so we can help them provide other services we need. And lastly, and quite importantly, we provide them some healthy foods that growing bodies need. In the WIC department, we have 5 WIC educators, 1 admin, 1 registered dietitian who sees the clients in the clinic, and myself, I'm the program manager. The funding for the WIC program is federal money. It is really comes out of the big farm bill, if you hear that on the news, the farm bill, which is funneled to the USDA, which is the U.S. Department of Agriculture. And so then that money from the farm bill is then distributed to states. So our state agency is the Colorado Department of Public Health and Environment, who gets the state money, who then filters it to Mesa County, who is the support of our funds. Our WIC program is under client services. You know, I think the WIC program provides some really valuable services. We provide, I think number 1 is our nutrition education. And we have a very vulnerable population. They're low income. To qualify for the WIC program, families have to be less than 185% of the poverty level. And so we have young women who are pregnant and they're really eager to do things right for their kids. So we have a great opportunity to give them evidence-based nutrition education. We have some really great resources for breastfeeding help, from breast pumps to staff who are really schooled in how to help a good mom be a successful breastfeeder. And certainly the foods that we provide, we're trying to teach healthy eating habits, and we're giving them some good food choices that they can feed their kids. And we know that kids have a vast variety and great taste buds, but we really want to train them, because often we eat those things we enjoyed as kids. So it's a good opportunity to give some new variety and food choices for their families.